Folks, what do you think about President Biden and the fourth stimulus check? Tell me in the comments down below. Fortunately, at this point, the backlog is still crushing the IRS, its employees, and most importantly, taxpayers. And that the backlog continues to grow is deeply concerning, primarily because millions of taxpayers have been waiting months or even more to receive the refund. While more than 90% of taxpayers filed returns electronically last year, roughly 17 million people sent the paper filings. The agency is processing more returns compared to a year ago, and it continues to make substantial progress on the backlog. But the agency in March shared plans to hire 10,000 workers, starting with 5,000 new employees. Now, new changes will be made, everybody, to President Biden's economic agenda. Lawmakers are finally addressing the rising inflation rates. Democrats are trying to find a new way to send out more financial aid to Americans, and recurring stimulus checks may be passed. Nancy Pelosi said today that Democratic leaders will gauge the party's support for President Biden's proposed gas tax holiday, but stop short of endorsing the idea. This is suggesting a rare break between the Speaker and her White House ally on an issue that's threatening Democrats' prospects at the polls in November. Speaker Pelosi said in a statement, "We will see where the consensus lies on a path forward for the president's proposal in the House and the Senate, building on the strong bills to lower prices at the pump already passed by House Democrats, including the Consumer Price Gouging Prevention Act and the Lower Food and Fuel Cost Act." The statement represents an enthusiastic response from a Democratic leader who is typically supportive of the president's agenda and reflects the concerns of a number of Democrats on Capitol Hill that suspending the federal gas tax simply won't show up as a significant savings at the pump. Democratic Representative Neal, chairman of the House Ways and Means Committee, told reporters the challenge on the gas tax is the savings really going to flow to the consumer, or is it going to be pocketed by the oil companies? And those are legitimate questions. Pelosi's legislative references were to a pair of bills designed to reduce gas prices. One by curbing price gouging and the other by promoting homegrown biofuels. Both have passed through the House this week, but still need to move to the Senate. Democratic leaders, everybody, had pursued those proposals in lieu of gas tax holidays, which Pelosi had rejected. At the time, she said there was simply no guarantee that the savings would pass along to consumers. The same concern is surfacing this week among other leading Democrats who had been long leery that a suspension of the federal gas tax, which has stood at 18 cents a gallon for decades, would translate into lower prices at the pump. Representative Neal stated, "We've got to figure it out again. Who gets the money?" And all of a sudden, it's a tiny savings for the consumer and big savings for the oil companies. It doesn't accomplish the goal that we want to see. What the administration idea is, and then we'll figure out how to react from there. In promoting a gas tax holiday, Biden said it would help struggling families through their bustling summer travel season. He's not only urged Congress to suspend the federal tax, but also called on states to suspend their own fuel taxes, which averages at 26 cents a gallon.
Understanding or push back on this rhetoric that we don't have a substance abuse issue and problem in our country, especially with even some, legal pharmaceutical companies pushing, the opioid, contributing to the opioid crisis right here at home. And many of my colleagues continue to actually benefit through political contributions from some of the same folks that continue to push those drugs onto our families. One of the things I want to talk about is that, expanding access to an opioid overdose reversal medication, as the Narcan, would help achieve so much in saving tens of thousands of lives, as doctor. And we've seen in places like Massachusetts, and where, Narcan distribution program reduced opioid overdoses and deaths by an estimated 11% without increasing opioid use. If I may, Chairwoman, I'd like to submit for the record a study to show some of the impact of that program, that distribution program.
Without objection.
Thank you. To maximize the life-saving potential of these treatments, it is imperative, as you know, Doctor, that the overdose reversal medication are affordable and easily accessible in every city and town across the United States. Director, how does the current administration's national drug control strategy increase access to Narcan so it can be readily available for people who need it the most, including those historically neglected communities like mine? I mean, you should know this, seeing some of the information.
Thank you, Madam Speaker. I ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and insert extraneous material on H.R. 6087, the Improving Access to Workers' Compensation for Injured Federal Workers Act.
Without objection, so ordered.
Thank you. Madam Speaker, I yield myself as much time as I may consume.
Gentleman is recognized for such time as he may consume.
Thank you, Madam Speaker. Today we are considering a straightforward bipartisan bill that will alleviate some of the barriers federal workers face seeking treatment and care after they've been injured on the job. Right now, whether we represent urban districts or rural districts, we're all hearing about the very real shortage of physicians, whether it's in general practice or specialty practices. That's why it's important for Congress to surgically and intelligently reform outdated, antiquated policies in place that prevent qualified providers from treating patients who need their care. This bill achieves that goal for federal employees who need treatment for workplace injuries or illness and will allow qualified licensed nurse practitioners and physician assistants to treat these patients safely and competently and be reimbursed under the Federal Employees Compensation Act. The bill explicitly states in Section 2 that such treatment must adhere to the scope of practice for nurse practitioners and physician assistants as defined by state law. I repeat, the bill was carefully crafted so that it does not encroach on the authority of state health licensing boards to determine the scope of practice. That is one of the reasons why the Education and Labor Committee came together on a bipartisan basis to unanimously endorse passage of this bill. Right now, injured federal workers who serve our nation at agencies such as the Department of Homeland Security, the Postal Service, and our national parks, to name a few, can only receive the care they're entitled to under the Federal Workers' Compensation Law if it's provided by a physician, and only a physician can certify a claim, regardless of whether the state the worker resides in allows nurse practitioners and PAs to practice independently. As any healthcare patient in America knows, nurse practitioners and physician assistants are a growing portion of primary care and healthcare workforce nationwide, especially in rural areas. Patients are ably and safely treated by NPs and PAs in these settings every day, and having the capability to be treated by a nurse practitioner or physician assistant increases access to more timely treatment, particularly in parts of the country experiencing physician shortages. The benefit of increased access was confirmed by the Congressional Budget Office in their analysis of this bill, which found that it would have no impact on direct spending by the government. Given the challenges some federal workers have in accessing their federal workers' comp benefits, allowing these providers to be reimbursed for the care they provide within the scope of their practice is an extremely common sense improvement. CBO has even stated that this legislation would help injured federal workers return to the job faster. In this labor market, anything we can do to improve workers' healthy recovery and job retention is worthwhile. This bill has been endorsed by the National Rural Health Association, the American Nursing Association, the American Association of Nurse Practitioners, the American Academy of Physician Assistants, as well as a diverse coalition